Chapter 38, The Preschooler and Family, Sandra Monk. Back to the first slide. Okay, promoting optimal growth and development. This is looking at the preschooler, ages 3 to 5, and they're getting prepared to go to school and be more separate from their family during this age. So it's going to be a real significant lifestyle change for them, going to school. And also their language and language development is, really increasing. And they use mental symbolization now. So, but sometimes they'll use the words, like they'll hear big words and they'll use the word in, an inappropriate, way, not an inappropriate way, but in a way that, doesn't mean what it actually symbolizes. And that's just normal part of children, learning words and learning their language. They now have an increased attention span and memory, and their physical weight it has changed now. It's slowed down a lot. Now they're only gaining about 2 to 3 pounds per year, and then their height increases 2.5 to 3 inches per year. And then slide 3, biologic development, and I think I've already covered that. Also, they have gross and fine motor behavior development during this time, with walking, running, climbing, jumping well, and all this is pretty much established by age 36 months. And they like doing this, and so they need ample opportunity to be able to do these sort of things. This age child cannot be still. They have fine motor refinement in their eye and hand and muscle coordination, and so they can draw better, do their artwork, and have much more skillful manipulation. So and also kids at this age, related to their gross and fine motor behavior, they might be they can ride a tricycle, walk on their tiptoe, draw a circle, and then they have a readiness for learning independence. And this is typically about age 5 or 6, where they actually, they want to learn. They don't want to be told, everything to do. Don't need to be told everything to do. And here's a 4-year-old child that has sufficient balance to stand and hop on one foot. You can see how satisfied he looks that he can do that. And then psychosocial development, as far as Erickson goes, he says they're in the stage of initiative versus guilt. So this child, they're very energetic about their learning, but they have feelings of guilt, anxiety, and fear that may result from thoughts that differ from the expected behavior. And a lot of this is because they're learning right from wrong, and they're beginning to develop morally. And they have a development of the superego or conscience, or their spirit, as you might ascribe to different beliefs. But and also they'll have rival relationship with parents of the same sex. And so sometimes, like a little boy might be thinking how they can, get rid of daddy, and daddy could move somewhere else, and then they could have mommy all to themselves. And so if that does happen, then they can feel kind of guilty about that. As far as Piaget goes, they're in the pre-operational stage, and with Piaget, this is it's not specific to ages 3 to 5. That stage goes from ages 2 to 7 years, and they shift from egocentric thought to social awareness, and they're able to consider other people's viewpoints, and they're a little less egocentric, although they still are some. And their language and speech is egocentric. It's a lot about me and I. And their concept of time is still very incompletely understood. So, like we talked about with hospitalization, you have to prepare a toddler to know about, if the parent needs to leave for a period of time, or if you're trying to describe some future event, like say Daddy will be home when the news comes on, or something like that. So you have to be kind of concrete. And they use magical thinking very frequently too, which is total use of imagination. So whatever you can think of that's imaginative, this is the kind of magical thinking that happens with the preschoolers. Moral development. As far as Kohlberg talked about pre-conventional or a pre-moral stage, and that slide just jumped, or a pre-moral stage, and this is where they begin with a punishment and obedience orientation. They realize that if they do things that please people, that that it's good, and if they are not, that they would be punished. And so they get very very socialized by that. And they have very concrete senses of justice, of what is fair and what is not fair. And their knowledge and faith and religion is learned from their significant others and from those religious practices. If they do not learn any specific religious practices, that's they later in life, that can occur. But it's very, specifically to different faith groups, research has shown that is when it happens, is when children are very small, and then continues to build. They continue to build in knowledge as they grow. The development of the conscience is strongly linked to a spiritual development, and sometimes they may misinterpret illness as a punishment for God, particularly if they live in a home where God is not seen, as loving. Then that can occur. The development of body image, they have an increasing comprehension of desirable appearances. They know who is little for their age, mostly because they hear people saying that, oh, he's little for his age, or oh, she's such a pretty child. And so this is where kids start getting those ideas about what's desirable and what's undesirable. And they become aware of racial identity and differences in appearances and biases. And that happens even at a very young age. And they they have poorly defined body boundaries, meaning they fear, like if their skin is broken, all their blood and their insides can leak out. And they also fear intrusive experiences that are frightening to all of us, which are surgeries, IVs, ports and PICCs and, NG tubes and those sort of things. That's where the child life specialists, if they are around, can come in handy, or a nurse gets very good at being able to teach a child, particularly in this age with so much imagination, what this invasive process is going to be like. Development of sexuality. They form a strong attachment with the opposite sex parents while identifying with the same sex parent. Modesty becomes a concern. They become aware that that they need to be modest. Sex role limitation. They like dressing up like, and this is usually established, that they like being like the parent of the same sex by the time they're even 1.5 to 2.5 years old. And their sexual exploration may become more pronounced, and what the experts say is to, just not make a big deal about it. Of course, you don't allow children, to continue, but they're just kind of curious, like, about how body parts work, why urine comes out of some parts in girls and different parts in boys, and so they just get kind of interested in that, and so they may do some exploration. So you don't want to make a big deal about it, but certainly, kids this age, you can distract them pretty easy and get them to doing what they should be doing. Social development, separation and individualization process is completed now. They know they're a separate other from their parents, and they're soon going to become separate others from their, although they know they belong, from their family as they, go out into the world, into kindergarten and into school. They have overcome stranger anxiety and the fear of separation from parents, which can be frightening because they may, end up talking to somebody or, kind of wandering off from the parents in a crowd. So that's a real need for safety with children of this age. They still need parental security and guidance, and particularly during hospitalization, they may really cling more to their parents as they regress some. They like the security of familiar objects, and play therapy is very beneficial in working through fears and anxieties and fantasies. So, like describing the equipment, in a way that's, just kind of fun and kind of matter of fact, and allowing them to, like look, hold things for you. Here, can you hold this for me while I untape your IV, or let them hold the tape while you're taping it, something like that, to, include them in the process, and so that they don't get wrapped up in fears and fantasies about what's about to happen. Their language is a major role of communication. Let me go back one slide. As a major mode of communication and social interaction continues to develop, like between the ages of 2 and 5, the vocabulary and complexity of language increases dramatically. A 3-year-old, they talk incessantly and ask why. Why? Ask a lot of questions, and most of them start with why, or how, or what. At age 4, now they start telling real exaggerated, imaginative stories, and they'll name colors, and they can obey prepositional type phrases, like, to go here or there and that sort of thing. And by age 5, they can name coins and other, and more of their colors. And there's some preschoolers enjoying some friends and having some nonverbal messages to communicate. They're both laughing and, you know, it's kind of happy at what they're doing. And that's there. Other personal and social behavior is they should be self-dressing, feeding themselves, trusted to obey warnings of danger, although you want to really watch them. The negativism, you know, really disappears during this age. You know, life gets pretty good as, you know, kids get towards 5, 6 years old. Generally, you know, they start being real sweet. They want to please. And this can be a real incentive. Well, I'll put in there for toilet training, but I think that's, you know, that's like way beyond where we're at. But but they're really willing to please. And some 3-year-olds may not be quite toilet trained yet. They have align with the family's culture and their code of conduct, and they begin to have internalized values and standards that are, you know, represented in the family, you know, how the family lives. And then they begin to challenge the family's code of conduct because they see other kids doing things differently and other families doing things differently than the way they do, maybe. And there's a preschooler able to dress himself, but they may need help with more difficult items. As far as play, they play in what is like associative play, imitative. They use their imagination. They love dramatic play, like dress up. Like I said, and it usually includes jumping, running, and climbing. And they have imaginary playmates. And this doesn't mean that the child is somehow cognitively, you know, developing in the wrong way. Particularly first kids and only kids, because they need somebody to play with and kind of. When they play, they learn who they are, and, you know, and how the world is and what the rules are. And so they kind of use this imaginary playmate, you know, to kind of bounce those things off of. And another thing they'll use their imaginary playmate for is this imaginary playmate did things that this child either wants to do or has done, and he thinks he might get in trouble for. And so they sometimes use that imaginary playmate to, you know, as the saying would go, they throw them under the bus, you know, saying it was the playmate's fault. So sometimes that's how they use them. Things they like to play with are like large blocks, crayons, coloring pages, coloring books, painting, clay, handicrafts of all kinds, and just, you know, really imaginative type of play. And then as far as sex education, I don't think we need to talk about that in play, but as far as sex education, I don't know if I have that on another slide. I'll just talk about that in just a minute. Basically, kids with sex education, you only answer what the questions are and be truthful, but you know, kids don't want to know a whole lot. You just basically, you know, answer things. You don't really need to over-answer things. I think I have another slide on that later on, but let's see. Here's a preschooler doing what preschoolers do best, playing. There's one in imaginative play. Okay, coping with normal concerns related to normal growth and development in preschool and kindergarten. That developmental screening tool is good, like the Denver, to assess for readiness for school. You need to begin talking to kids about infectious control in the school setting. The thing with you know, kids, though, one thing to be said about preschoolers, many of them have spent their whole life in daycare centers, so a lot of this stuff is not new to them, like being away from the family and being out of the home. But for some kids, it's totally new. You know, kids maybe that, you know, the parents have kept them at home until now. And the thing about daycare centers is there's more kids together in one place, and so they're more likely to contract infections from each other. The way my pediatrician described it is like every 3 months a kid gets a cold, and then they get with other kids, and then it starts being every 6 weeks that a kid gets a cold, and then it starts getting into other things. So hand washing, little kids, it's not too early to teach a 3, 4, and 5-year-old about hand washing to prevent germs. And then if they have not been to school before, there needs to be some introduction to school and some preparation for, you know, what that might be like. You know, whether they're, you know, think about what their older brothers and sisters do, or where, you know, they maybe just, you know, get an opportunity to go see what, you know, school is like, and take that opportunity to introduce the child to that, so they're not kind of surprised. There's hand washing. Okay, sex education. I was talking about it ahead of my slides. But so just find out what the children know and what they think. Be honest. Avoid over answering. And then we've already talked about if they are doing, having sexual exploration, to how to talk about that, and just because kids are just kind of curious about anatomy being different at this point. Fears. They do not like being in the dark. They are afraid of monsters and all sorts of things. And because of that great imagination that they have at this time in their life, they fear being left alone. Because here they are venturing out from mom and dad and family, and could they get out there and not get back? So that's a real kind of concern to think about. Some days I think about that myself. Animals. Sometimes some kids are really afraid of animals. A kid should never be forced to touch a dog or a cat. If they don't like dogs or cats, just let them slowly over time learn that they're okay or not. But that kids just don't need to be forced into that. Maybe if you take them to the zoo and they kind of see snakes are okay. Some snakes are, but you don't want children to be too friendly. With other people's animals, like, any dog will bite. So like petting a dog, that's not the family dog or something. So those are some kind of safety kind of considerations to take in. And then, also not feeding into their fears by making them touch an animal or being close to an animal that they're really truly afraid of. Another thing that kids have, because they're learning these concepts about what's an animal and what's a person, is they have something called animism. And this is where, they think that animals, are like cartoons and things like that can really be alive. So like you're trying to toilet train a 3-year-old and he's seen a commercial with a Tidy Bowl man. And so that, they think, oh, there was someone in the toilet or things like that. They're afraid of ghosts if they hear about ghosts. I mean, anything that they think, that, particularly if other people convey that this is a scary thing or this is a thing that you should be afraid of. So those are all some kind of things. Sexual matters, children sometimes have fears of something happening to their genitalia. And then objects or people associated with pain. So that is why, as far as the sexual matters, if kids having those kind of fears, they might be really afraid of having, a calf. And then also objects and people associated with pain. That's why we use the treatment rooms, and we don't try to do things that would cause fear and cause pain to children in their own beds, and particularly at this age. Stress. We talked about this, I think, the first day of class. One of the groups talked about stress. And they said that minimum amounts of stress can be beneficial, and I agree with that. That, kids need to, once you leave the home, things can be, or, you're going to be subject to change. Things are going to, happen that are outside of your control. And kids need to learn how to not be afraid during those times. And then, parents just need to kind of be aware of, what kind of things are stressing the kids. If there has been a divorce or separation, kids are living in different places. That can be very stressful sometimes, being in different households, having different rules. And so parents just need to be aware of that, because that's our role as parents, is to protect our children. You want to schedule adequate rest, because kids will play and they need adequate rest in order to grow in every way. And you need to prepare a child for any upcoming changes to maximize coping strategies. So we talked about this in regard to hospitalizations, and one of the things that we said was, like a kid this age, you might not want to prepare them, a week ahead of time, but, just like, maybe no more than a week ahead of time, but to kind of talk through some of these fears, but not any longer than that, so that they have time to make it worse than what it's, actually going to be. Aggression. Kids during this age can have aggression, and this is where, we need to set boundaries, set limits, and help kids, not to hurt or destroy property, and explain to them that, this is, not acceptable. And they can be influenced by all kinds of biologic, sociological, and familial type variables. It can be something like anger, like uncontrolled anger, and maybe they see this aggressive behavior, and goes way beyond anger, that they see in television, that they see, everybody's shouting on television. even in the commercials, or maybe they see violence within their family. In addition to, things that they might see on television or movies. And that's the reason it's important to, both, settle family agreements, learn how to settle family agreements so that kids can learn how to do that. It should be a goal for every family. And also kids, sometimes because of frustration, if they are constantly if there's constant disapproval, humiliation, and punishment, kids, they get real frustrated because they never can really figure out what they should be doing. And this is the age they want to know if they're doing things right and that they're accepted. So we talked about modeling, and then reinforcement. If a child is ignored until they clobber their younger brother, then they're going to see that as a way of being rewarded by being aggressive. So those are just some things to think about. Speech problems, really common in this age group. Stuttering and stammering, kind of disfluency. And the Denver Articulation Screening Examination is a good tool for assessing speech problems. But generally, this is just something that is pretty normal as they learned, their language between ages of 2 and 5. And parents should, there's a thing called dyslalia that they get if they're kind of like forced to do more than what they can do. They're doing the best they can because they're still learning, normal speech development during this age. Although, we think that they should because they're using big words sometimes, and other times they're stuttering and stammering. So I can see how parents would, get that kind of information. But this is normal, and they generally will, go past that. But if not, and it's very severe, then it definitely needs to be checked out by a speech therapist who can come up with some exercises, and most speech disfluencies are, solved by the time a child gets in 2nd and 3rd grade. Promoting optimal health during the preschool years, they got to have good. They must have adequate, good caloric intake. And they can eat upwards of like 1,800 calories a day. And I think I've said before, I can't eat 1,800 calories a day, but kids can because they're so active, running and playing, and they have an increased need for protein during this age as they, develop their body organs are still continuing to develop. Their fluid requirements are about 100 milliliters, per kilogram, depending on their activity and climate. It's hotter, they need more water. Water is the beverage of choice for all children. And they either are food fans, or either they only love, chicken nuggets, or they only love broccoli, and they have some strong preferences for food. One way that you can help with that is just kind of live through it because they'll get over it. But the other thing is to, kids enjoy helping to make food, and sometimes that'll help them want to eat the food if they help prepare it. And it's just for some kids, for a short period of time around age 4, it gets into like a control issue about what I can eat and that sort of thing. So that is, My Pyramid Kids. That's on the web. You could, study that with a child and let them see the colors and, what they should be eating and what's good for kids and help you to, grow, be strong, and those sort of things. They must have adequate calcium. They must have adequate vitamin D. And juice intake for 1 to 6 years is only 4 to 6 ounces a day. So juice is not a beverage of choice for every meal. They got to have some milk, and they need to have lots of water. Sleep and activity. They should have about 12 hours of sleep a night, and kids this age may or may not have a nap and frequent naps. I don't think it hurts a kid to have a nap, or at least lay down and be quiet for a little while during the day. Free play is encouraged, and emphasis on fun and safety, like water safety and jumping from high heights, kind of things. Some kids during this age will have sleep problems like nightmares and then sleep terrors. Nightmares, the kid is can be easily awakened and gotten back to bed. Sleep terrors, not so much. Those are something totally different. And you want to encourage a consistent bedtime routine. It's called sleep hygiene. It works for anybody at any age, but going to bed at a consistent time and getting up at a consistent time every day, and naps, consistent or not, or a rest period. Sleep problems. They need, if they have any of these like nightmares or sleep terrors, they need to have an evaluation of that. Could be migraines, could be partial seizures. It could be a lot of things, particularly if it's very severe and they're having them real frequently. Dental health, eruption of their teeth is complete, the deciduous teeth. So we need to take good care of those so that the underlying structures will remain good. So they should be able to brush their teeth by themselves, but they still need supervision of parents. And as far as professional care, they probably need to have their teeth cleaned every 6 to 12 months, and fluoride supplements. Injury prevention. So safety education is real important with parents because kids at this age, sometimes they'll do things that they see older siblings doing. So they need to know that they can't cross the street by themselves, or they can't go to the store by themselves on their tricycle. And that's something that they might try, and they'll take you so literally. They come up to you and go, "I'm going to the store, Mommy," and you say, "Okay," and the next thing you know, they're barreling down the street going to the store because they take things so literally. So those are some kind of things to talk about with safety education, and always holding hands, when you cross the street, because it's just what we do. You tell the child that's just what we do. In this family, that's what we do. Pedestrian motor vehicle accidents increase because kids get out of car seats, still need to be in car seats, or still need to be on a booster, depending on how much they weigh. They're going to weigh under 80 pounds. Development of long-term safety behaviors like bike helmets. Kids need to know that they need that. They need to, if it is a sport that requires safety equipment, they should not play the sport unsupervised without the safety equipment, like tackle football and those sort of things. Anticipatory guidance for families. Child care now focus shifts more from protection to education, and children will start to question the previous teachings of their parents. So now we're not having to we're having to really focus on, now they're going to be away from us, so we've got to really focus on you need to wash your hands, you need to listen to your teacher, you cannot play in the street ever, and those sort of things. And then children begin to prefer the companionship of peers, particularly towards the end of this period as they get into early school age. Maltreatment. This is the intentional physical abuse, emotional abuse, or neglect or sexual abuse of children. And there are different types, and we're going to talk about those. We'll talk about those more in class. But physical neglect, types of neglect. Sometimes it's not intentional. It's because people don't know, and other times it is very intentional. And people, adults, should know better, and it's but maybe they haven't learned, and we need to help identify that and to intervene. Attentional physical abuse is only about 17%. Usually it's mostly like neglect, where children are not fed properly, or people are in a rush, so they feed the kids potato chips for breakfast, just because they think that's the best thing to do. And emotional abuse or neglect is usually about 7%, where maybe children are left alone for long periods of time, unsupervised because of babysitting type situations, or other types of disruptions in the family. And then sexual abuse is 9% of the time. Physical neglect is deprivation of food, shelter, supervision, medical care, and education. So if you fail to, one of these things that, like if you fail to send your child to school, would probably get a person, because it's easily identifiable, a lot more quickly than, what goes on in the house, like when kids are not at school and so forth. For a lot of children, school and even hospitalization can be a shelter of safety, and so in some of the environments that they live in. Emotional neglect is a lack of affection, attention, or emotional nurturance. Families that just let their kids kind of raise themselves, and just kind of, they're ignoring them because they've got their own issues, mental health issues, going on. Emotional abuse will destroy or impair a child's self-esteem, and so it is, this is something that needs to be intervened on pretty quickly too when it's recognized. Physical abuse is the deliberate infliction of physical injury on a child, way beyond what is, might be considered, corporal punishment or spanking, those type of things. Shaken baby syndrome. It is never okay to shake a baby. The violent shaking of a baby or a young child, will cause the child to have a brain hemorrhage, and which they will, may not ever recover from. So it is never okay. So we need to intervene when we see that there's like postpartum syndrome, that there are problems with, maybe consistent, child care delivery and those sort of things, and just, try and find out as much as we can. And when a child shows up that, has the symptoms, that, that they, became unconscious and, for no given reason, but, that they'll look for, eyes that are blacked or, petechia on the child, and, begin to set up a, an idea that, and begin to investigate, a little more. Munchausen syndrome by proxy is a factitious disorder by proxy or medical child abuse. These are like kids that are like sick a lot, but the parents are kind of making it up to get attention for themselves. And so it really can be bad because the kid like ends up, maybe having to go through a GI series because, the parent keeps saying that they have this stomach problem, to the kid thinks, well, I've got this stomach problem. And maybe they do have, maybe they have had, something, but, they may end up like going through, like a whole bunch of GI series and a whole bunch of tests and, EMGs and, MRIs and, things like the kids just don't need to have. And plus then they think they're sick. And so, it impedes them, emotionally as well as, physically they're held back. So, is something that has to be identified and addressed. A lot of times, the parents they'll physician shop and hospital shop. They'll end up in like different hospitals because they get mad at the other doctor who tells them there's nothing wrong with the child. So this is something that social services has to help, intervene with the family on. Predisposing factors to physical abuse, parental characteristics. It often is in a family that lives in social isolation. They don't do anything outside the home. They don't belong to a church. They don't, the kids aren't in sports. So this is like characteristic. I'm not saying this is, every time. Young parents, because they maybe become frustrated in the role that they're in and, are not prepared to be a parent. Single parents, it tends to be because they take out their frustration maybe on the child. Characteristics of the child. Children who are disabled, preterm, and under ages 3 are more likely to be physically abused. And as far as environmental characteristics, divorce, poverty, and unemployment can lead to it. Not because people don't have a job, but that they don't have anything to do but, abuse their children. But, it can lead to like some frustration and, some other, or maybe they're unemployed because, there's a reason why they're unemployed. So those are just some predisposing factors when you're thinking of red flags and, things are just kind of popping in your mind. Sexual abuse is described as the use, persuasion, or coercion of any child to engage in sexually explicit conduct or simulation of such conduct for producing visual depiction of such conduct, or rape, molestation, prostitution, or incest with the child. It is never okay for an adult to have any kind of sexual, relationship or any kind of, sexual, talk or anything with a child. It's just never acceptable. No matter what the age difference is, it's just not, it is not acceptable. Some of the things that happen, incest within families, molestation such as exhibitionism, child pornography, child prostitution, and then people who have an illness that they are just inclined and want to be sexually attracted to children. And so all of these things are things that have to be investigated. If it's kids will bring up things like this that that happen at home or some other a child comes into the hospital and maybe there's not a real connection to who the child belongs to, as far as child prostitution and those sorts of things. Child pornography often are discovered, and then so it's just none of those things are ever ever acceptable. Characteristics of abusers. The typical abuser, sorry, go back a slide. The typical abuser is a male who the victim knows, but it may not be. It can be anyone. But this is pretty typical. But we've seen it in media and in the news. Female abusers of victims that are in all ways, of all economic backgrounds. It's not any respecter of of persons or social class or anything like that. It's just something that is a problem in society that needs to be addressed. And you are a first reporter. I mean, you are a mandatory first reporter as a nurse. And so, if you suspect anything like this, it has to be brought forward and reported to social services so that an investigation. And if you're wrong, you're wrong. But if you're right, then perhaps you've saved and preserved the life of the child. Nursing the care of a maltreated child, you want to identify abusive situations as early as possible so the child doesn't have to endure it any longer. And also, get a really good history. And if it's inconsistent history pertaining to the incident, then maybe social services needs to look into it. Evidence of maltreatment, there may be a pattern or a combination of indicators that arouse suspicion that would require, a certain type of intervention, further investigation. And the child needs to know that they have not done anything wrong and that it is okay to report. And you can never tell a child that you will keep a secret from their parents, because, you can't keep, this is not a secret that you can keep. This has to be talked about, and you need to let the child, know that, because this child really needs to be protected from further abuse. So those are some of the special concerns and transitions from being the end of toddlerhood, the early childhood years or preschool years into kindergarten.